Good afternoon, everyone. Bonjour tout le monde. La semaine dernière, nous avons franchi la première et ensuite la deuxième étape en vue de retour à la phase d'alerte verte au Nouveau-Brunswick. Ainsi, il a été possible d'assouplir certaines des restrictions qui nous ont été imposées depuis le début de la pandémie. Les citoyens du Nouveau-Brunswick peuvent maintenant se réunir en plus grand nombre, voyager plus librement et reprendre certaines activités que nous associons tous à une vie normale. We took this action because it was what we said we would do when we set out on our path to green last month. We did not act in haste or without due consideration for the safety of New Brunswickers, and keeping everyone safe and healthy is and will always be our top priority. The steps we have taken are based on science and grounded in evidence. They are based on a reduced risk of outbreaks of COVID-19 and the capacity of our healthcare system to meet these outbreaks when and where they occur. Au fur et à mesure que les taux de vaccination augmentent, le risque que d'autres éclosions mettent en péril notre système diminue. Le risque ne disparaît pas complètement pour autant. Les consignes et recommandations de santé publique demeurent en vigueur et il est plus important que jamais de les suivre. Getting back to a normal life is about determining an acceptable level of risk for our people and the healthcare system that looks after them. In setting out our path to green, public health looked at the evidence of the progression of the virus and considered where and when we could begin to reduce restrictions. Comme 75% de la population a été au moins partiellement vaccinée, nous avons convenu que nous pouvions lever certaines restrictions sans pour autant compromettre la santé et la sécurité du public. Lorsque 20% de nos personnes les plus vulnérables, soit les personnes âgées de plus de 65 ans, auront été complètement vaccinées, nous serons en mesure de lever d'autres restrictions présentement imposées dans la province. Combined with rising vaccination rates and declining case numbers across Canada, we determined that we could reduce some restrictions for travel in and out of the province. We have achieved these milestones, and we are now on our way to our next target, getting the majority of New Brunswickers fully vaccinated against COVID-19. Are we in a risk-free environment? Absolutely not. If we waited for the risk of COVID-19 to decline to zero, restrictions would still be in place and would remain in place for the foreseeable future. COVID-19 is still with us and will be with us for some time to come. But by reducing these risks, we are creating the conditions where we can live with COVID-19 and begin returning to something that looks like normal. Today, Public Health is reporting one new case of COVID-19 in New Brunswick. The new case is an individual over the age of 90 residing in Zone 6, which is the Bathurst and the Acadian Peninsula. This is a contact of a previously confirmed case. There are now 43 active cases of COVID-19 in the province. Again, this is the lowest number of active cases we have seen since mid-March. Great news. Unfortunately, we do still have people who are in the hospital. So as of right now, we have 5 New Brunswickers in hospital due to the virus, including 2 who are in intensive care. So as you can see, COVID-19 continues to disrupt the lives of many New Brunswickers, those with the disease, their friends, their families, and those who are self-isolating to prevent the further spread of the virus. These people all need our support. Please keep them in your thoughts and your prayers. Aujourd'hui, Santé publique annonce qu'il y a un nouveau cas de COVID-19 au Nouveau-Brunswick. Il s'agit d'une personne âgée de plus de 99 ans habitant dans la zone 6, soit la région de Bathurst et de la péninsule acadienne. Cette personne est un contact d'un cas déjà confirmé. Il y a présentement 43 cas actifs de COVID-19 dans la province. Encore une fois, il s'agit du plus petit nombre de cas depuis la mi-mars. Il y a présentement 5 citoyens du Nouveau-Brunswick qui sont hospitalisés en raison de la COVID-19, dont 2 aux soins intensifs. La COVID-19 continue de perturber la vie de nombreux citoyens de la province. Les personnes qui ont contracté le virus, leurs amis et les membres de leur famille, ainsi que toutes les personnes qui s'isolent pour prévenir la propagation du virus, ont tous besoin de notre appui. Je vous demande de les garder dans vos pensées et vos prières. We all want to reduce the risk of more cases of COVID-19. The best and surest way we can make that happen is by getting vaccinated. We are making steady progress in getting New Brunswickers vaccinated, and as of today, 76.5% of New Brunswickers over the age of 12 have received at least one vaccine dose. We have fully vaccinated 21.5% of our population, and that number will rise quickly in the coming weeks now that every eligible New Brunswicker can now receive a vaccine. It remains urgent that we get vaccines into the arms of as many New Brunswickers as possible and as quickly as possible. Si vous n'avez toujours pas pris rendez-vous pour recevoir votre deuxième dose, je vous prie de le faire dès que possible. N'oubliez pas que vous pourrez obtenir un rendez-vous plus rapidement si vous faites preuve de flexibilité à l'égard du vaccin que vous recevrez. Those who received a Pfizer-BioNTech product as their first shot can get a Moderna vaccine for their second. These vaccines work in exactly the same way and are equally effective separately or in combination. As the supply of Moderna vaccines is increasing and there has been a delay of shipments of Pfizer, we do want to use these vaccines which are available to us so that we can maintain our momentum of our vaccine rollout to maintain that very high level of protection for all New Brunswickers. If you have waited to get your first shot, there's still time. Please consider joining the vast majority of New Brunswickers who have acted to protect themselves and their communities. We do see outbreaks emerging in other parts of the country and in other jurisdictions, and these are mostly amongst people who have not been vaccinated. Bien qu'il soit important de vacciner tout le monde, je tiens à encourager spécialement les citoyens de moins de 40 ans à se retrousser les manches et à se faire vacciner. Plus de 60% de vous ont déjà reçu une première dose du vaccin. Si vous y songez encore, je vous encourage à prendre rendez-vous. Communiquez avec votre fournisseur de soins de santé ou avec votre pharmacien si vous avez des questions. On voit que c'est la meilleure protection contre l'hospitalisation et les symptômes sévères. Please do it for yourself, please do it for your families, and please do it for your friends and colleagues and community members. Vaccination is the straight path to a more normal summer. It is the straight path to removing remaining restrictions that have been placed on our lives. It is the path to green. The road ahead is now clear, but there are no shortcuts. If you want to see New Brunswick reach that green level as quickly as possible, please go out and get yourselves vaccinated and encourage your family and friends to do the same. Thank you very much. Merci beaucoup.
Good afternoon. Bonjour. Firstly, I want to discuss the situation on the Nova Scotia-New Brunswick border. It's never helpful to have blockades that certainly prevent not only transit for economic reasons and purposes, but people that livelihoods depend on movement, free movement back and forth across the border. It's important that we don't lose sight of our objective. We know that there's been some differences in how we're rolling out and moving forward in kind of getting beyond COVID. We also know that we're all very tired of COVID, and no one's any more tired of it than I am. But this isn't a time to lose control or lose patience or cause disruptions to friends and neighbors. This is a time that we exercise restraint. We keep moving in a direction that's getting us back to life as normal, and we do so in our respective areas that are providing the best healthcare needs and opportunities. We are on the cusp here of getting back to green, and we will work through the issues within the Atlantic region, and I'm confident that we will be able to do so. I'm going to be meeting with my Atlantic colleagues following this newscast, and I'm confident once they understand what we're doing and have been doing for 16 months to protect the entire Atlantic region hasn't changed. We are very comfortable with the recommendations of public health. We're very comfortable with the capabilities that they've demonstrated throughout the entire pandemic, and I've never been more confident in our path forward as New Brunswickers and as an Atlantic region as we work together. So I would just encourage the blockade to open up. Let's move back to normal in that regard. And I'm also confident that we will get our friends and neighbors back together on both sides of the border between our Atlantic provinces, and we will make all of this work. But let's not lose sight of the big goal at the end of the day, and let's stay focused. When we announced our path forward on May 27th, it was a path to green, a path that had some very precise requirements to meet in order to go to the next phase. It took a phased approach of easing the COVID-19 restrictions. It's based on recommendations of public health, and it was approved by the COVID Cabinet Committee and all of Cabinet. Afin de passer aux prochaines étapes de notre retour à la phase verte, la zone de Nova Scotia devra atteindre des objectifs de vaccination précis. Le nombre de hospitalisations devait rester faible et toutes les zones de santé de la province devra rester dans la phase jaune. Phase 1 was reached once 75% of New Brunswickers 12 and older received their first dose of vaccine. We then hit our next target of providing 20% of New Brunswickers aged 65 and older with their second dose, allowing us to move to Phase 2 1 week ago on June 16th. J'ai une grande confiance dans les mesures que nous prenons pour ouvrir notre province au Canada Atlantique et au reste de notre pays. Comme l'a dit le Dr. Russell, c'est une approche prudente. Elle est basée sur l'augmentation de taux de vaccination partout au pays et sur la diminution du nombre de cas graves de COVID-19 grâce à nos niveaux élevés de vaccination. We promised New Brunswickers that if they reached the targets for Phase 2, we would begin to ease travel restrictions and make it possible for them to reunite with their family and their loved ones from other provinces. Our residents did the hard work to reach those targets, and I am incredibly proud of how quickly our vaccination rate has risen and continues to rise. As of today, 21.5% of New Brunswickers 12 and older have been fully vaccinated, and 76.5% have received their first dose. The rules within each phase on the path to green have not changed since they were announced in late May. And while we were slightly ahead of our Atlantic Canadian counterparts in beginning to open our province, we let them know about our guidelines and were clear in our public briefings. As we learned from yesterday's announcement, Nova Scotia has decided to move in a different direction. This is indeed their choice, as all provinces have worked to the best conditions around their situation and what they thought was prudent for their residents. New Brunswickers, we need to accept the rules and respect the rules that they've chose for travel in Nova Scotia. If Nova Scotia wishes to, they can set up their own border control measures. However, it's important to understand that our border control measures continue, as they have done so for 16 months. Prince Edward Island and Newfoundland and Labrador are opening to New Brunswickers, but as always, we encourage residents to check with other provinces before traveling to ensure they are following the respective rules in each province. Our rules in New Brunswick are not changing. Throughout the pandemic, New Brunswick has been the safeguard to Atlantic Canada. We continue to monitor the Quebec border as well as travelers arriving in New Brunswick airports. Just yesterday, 62 vehicles were turned away from our border for not meeting our requirements. This includes vehicles heading to Nova Scotia, Prince Edward Island, and Newfoundland and Labrador that do not meet the requirements of those provinces. I wish to thank Border Security, our folks from different parts of government that have played a key role in guarding our borders from the very beginning. Their diligence to do so has made all of the difference and allows us to continue the confidence that we have in moving to green. When travelers identify that they are traveling through New Brunswick to other provinces, we can share that information to any of our Atlantic colleagues. So they can follow and track the newcomers coming in. They can cause them to be further aware of the rules and track that they follow them. Les personnes qui entrent au Nouveau-Brunswick en provenance d'une autre province de l'Atlantique n'ont pas besoin de s'y isoler. À la condition n'est pas avoir voyagé à l'extérieur des provinces de l'Atlantique, de la Première Nation, de la Louis-Auguste, ou des régions de Témiscamingue et d'Avignon au Québec, dans les 14 jours précédents. Les gens du reste du Canada sont aussi les bienvenus s'ils ont reçu au moins une dose d'un vaccin contre le COVID-19 ou s'ils ont un plan civilement approuvé. Ils doivent également avoir enregistré leur voyage. We have taken the stance, supported by public health, that vaccination is our greatest defense against serious effects of COVID-19. We cannot continue to impose the same restrictions on people that were in place prior to the availability of vaccines. COVID-19 will still be with us for a while, but we can reduce hospitalizations, reduce the severity of the disease, and eliminate restrictions by getting vaccinated. Other provinces can, of course, continue to make their own decisions about what steps they feel are necessary within their borders. I will be engaging with premiers from the other Atlantic provinces later today to discuss what their future plans look like and how we can provide additional information and work together to reinstate the Atlantic bubble. In the meantime, we will continue to move forward in our vaccination efforts. Tous les gens de Nova Brunswick admissibles qui veulent se faire vacciner peuvent prendre rendez-vous dès maintenant pour leur deuxième dose, à la condition qu'ils aient reçu leur première dose il y a moins 28 jours. J'encourage tous les gens de la province à se faire vacciner dès qu'ils sont en mesure de le faire. We are continuing to make doses available as quickly as possible, and the number of people getting vaccinated at regional health authority clinics and pharmacies across the province is climbing every single day. Compared with the other provinces, as of yesterday, New Brunswick had the fourth highest percentage of people aged 12 and older who have received at least one dose. We are also leading Atlantic provinces with our second dose vaccine rate for people 12 and older. And I just commend the people of this province who have taken this so seriously. And that's why it's important for us to stay on our program. You're doing your part. I need to do mine. So keep up the great work. We are well on track to reaching our next target of vaccinating 75% of New Brunswickers 12 and older with both doses. The day when we can fully move to green and lift the mandatory order, returning to life with no restrictions and no masks, is just around the corner. With your continued cooperation, we will reach that goal soon. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Merci, Monsieur le Premier Ministre et Dr. Jennifer Russell. We'll now proceed with questions from the media. Each reporter will have one question. You've got the right to pose your question in the official language of your choice, and please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. Veuillez vous assurer de désactiver les sons sur vos micros. Michel Corriveau, Radio-Canada.
Bonjour, c'est une question pour le Premier ministre Blaine Higgs. Alors, Monsieur le Premier ministre, est-ce que vous avez déjà eu une discussion avec le Premier ministre Rankin? Je comprends qu'il y en a une ce soir avec l'ensemble des ministres, des premiers ministres. Donc, avez-vous eu une discussion déjà avec le Premier ministre Rankin et quelles solutions proposez-vous pour accélérer l'intégration du Nouveau-Brunswick dans la bulle avec la Nouvelle-Écosse?
So our staffs have been talking with each other in terms of between Nova Scotia and New Brunswick. I have been speaking directly with the Premier of Newfoundland and PEI about our call later today, and in which Premier Rankin will be involved as well. So we'll work through. I think that the solution here going forward is that, you know, we are collecting a lot of data. We have from the very beginning. We continue to do so at our borders. And then the rules can be applied in the individual provinces as they would see fit. And I think that as we open up with Canada, there's always going to be some struggle in terms of, okay, what works, what doesn't work for each province. But as I mentioned in my message today, we can certainly provide the information to the provinces of people that are registered and coming forward to their province, because we've had that information and we've been monitoring it from the beginning. So I feel that as of when our meeting is today, we'll come up with a solution, and I'm hopeful that we will certainly get our Atlantic bubble functioning properly very, very soon.
Khadil Abraham, CBC.
Thank you. Premier Higgs, to enter Nova Scotia, New Brunswickers are being told to upload their proof of vaccination. Will the province be providing a more official and tamper-proof digital record, and when?
Well, I guess that can be a discussion this afternoon in relation to what record works for each province. But what we have said is that they have a registration policy which we need to follow as a province. It's no different than other registration policies. But what I'm hoping here is that if the Atlantic bubble opens, as I believe it can and can do so quickly, then we have the free movement through the Atlantic region. And that's what the goal is right now. And that's what I'm hoping that that the four of us tonight can resolve. And we'll work with each of the public health guidelines in each province. But we get freedom of movement throughout Atlantic Canada, and then we're only talking about those that are coming from outside of the Atlantic region.
Thank you.
Thanks, Adil. And Natalie Sturgeon, Global.
My question is for Premier Higgs. Premier Higgs, I was wondering what your reaction was to the restrictions that were sort of announced yesterday in the 11th hour and the blockade that is now happening at the border. And when you speak to Premier Rankin, how do you expect that conversation to go?
Well, certainly I'm very disappointed in the blockade. I mean, that's not going to solve anything, and it just further disrupts people that are trying to get on every day with their daily lives, and many whom are working on either side of the border, or they're providing essential services in transportation of goods. So that's disappointing, and we need to get beyond that and get things opened up. But I believe the conversation tonight, I mean, we'll all be adults in the room, and we'll go through the rationale that each feel is appropriate for their province. And as I said, if we're very comfortable with where we are and the measures that have been taken and the recommendations put forward and the process we're on. We announced it, now it's been like 3-4 weeks ago, and we're sticking to what we committed to New Brunswickers to do. And it's very important that we do that. I think the conversation we'll have tonight will be all right. If you're concerned about people coming from other parts of Canada, we're at the border the way we've always been for the past 16 months. We stop every car. We can provide the information because we're recording it, and you can follow up and implement your own regulations with outside of the Atlantic region entrance. So I'm confident we'll have a path forward, and I'm excited about that happening sooner than later. And when I'm talking sooner, let's hope within a very short hours, not days.
Thank you.
Thanks, Natalie. Mobe Mambodo, Radio-Canada.
Oui, bonjour. Merci pour la question. En fait, peut-être pour Dr. Russell en français, d'un point de vue de santé publique, pourriez-vous un peu plus aller en profondeur dans le fait que les mesures sont prudentes ici, puis d'un point de vue de santé publique aussi, est-ce que vous comprenez, vous, parce que j'imagine que vous parlez avec Dr. Strang, alors comprenez-vous la décision de la santé publique de la Nouvelle-Écosse?
Alors, comme le premier ministre a dit, chaque province a leur propre approche à gérer la situation avec la pandémie. Au commencement de la pandémie, les risques qu'on a identifiés ici aux provinces atlantiques, c'était vraiment au niveau des hospitalisations et la capacité de nos systèmes de soins de santé comme région. Ça n'a pas changé. Les risques pour la capacité de notre système de santé, c'est encore la priorité. Il n'y a pas de question. Et la surveillance qu'on va faire au fur et à mesure qu'on a les restrictions diminuées pour les frontières, pour les voyageurs de d'autres endroits du pays, ça va être quelque chose qu'on est vraiment intéressé et impliqué dedans. Alors, certainement, la surveillance qu'on a aujourd'hui, c'est qu'il n'y a pas eu un cas de COVID-19 qui a été importé dans un autre endroit du Canada depuis plus que 2 semaines. Alors, on est vraiment confiant, on a beaucoup de confiance dans les vaccins à ce moment-ci. Le fait que les autres provinces du Canada, tout autour du Canada, on a un taux de vaccination dans la population du Canada est vraiment élevé à ce moment-ci. Ça continue à augmenter et fur et à mesure qu'on a la protection des deux doses, ça c'est le protection maximum qu'on va voir avec les vaccins. Et on sait que ça, à ce moment-ci, peut remplacer les mesures qu'on a mises en place qui ont été très restrictives, très sévères pour la population, non juste pour les Néo-Brunswickois, mais aussi les gens dans d'autres parties du Canada qui ont vécu les sacrifices et le travail qui a été fait depuis les dernières 16 mois dans la pandémie. Alors, à ce moment-ci, on voit aussi que le nombre de cas dans les autres parties du Canada est diminué aussi et que ça continue à diminuer. Et on a toujours vu tout au long du pandémie que si les nombres de cas étaient élevés dans les autres parties du Canada, nous, ici, au Nouveau-Brunswick, on voyait des nombres de cas importés des autres endroits du Canada élevés. Alors, fur et à mesure qu'on continue à voir les nombres diminuer, ici, au Nouveau-Brunswick, on voit que les nombres de cas se diminuent.
Merci, Maude. Vicky Hogarth, CHOC TV.
Thank you. Premier Higgs, was Premier Rankin able to give you any advance notice of his decision to exclude New Brunswick from the Atlantic bubble yesterday? And what key issues do you hope to resolve with him in particular tonight?
Well, not directly. I guess when we had spoken prior to our opening in relation, back before we'd hit the 75% level, so the week prior to that, I kind of laid out where our path would be if the vaccination levels set forward in the same direction that they were proceeding. So in any case, when we got there, that kind of threw some things in question about, okay, when can the Atlantic bubble actually bubble again? And there were different feelings from different regions for what I said they all had kind of their views on what works for them, and that's fine. We all respect that. So I didn't really know about the change or not much in advance, but was I surprised that there would be something? Not really. I guess maybe a little surprised that New Brunswickers would be, it would happen so quickly and so, because it impacted so many people that were already making plans to go and visit their loved ones and that they hadn't seen and friends for a long time. So it had more of an impact, I think, on individuals that it would be so quick to put in force. As far as tonight's concerned, I think that we, as I've said, we have the information that we've been collecting from the very beginning. We're doing it every day the same. When we implemented phase 2, we're still doing the same thing at the border. You got to be registered, and depending on your vaccination levels, you have this protocol to follow. And so we know that if they're going to Nova Scotia or they're going to PEI or they're going to Newfoundland, and I've offered, and certainly we can share that information, and they can enforce their own rules in their own province. But it doesn't mean you need to impact the Atlantic region as a whole. So I think we have a path to a bubble, and we can get back in Atlantic Canada to be like we were and like we want to be, and it's only a matter of days or weeks that we're into a situation with the rest of Canada. I mean, we're already there, but I think even with the other provinces, it's going to be a short term where everyone's going to be there, and I think some of the Atlantic provinces are more so than others right now. So I'm thinking tonight we'll map out a path that basically we can share information that we're already collecting, have been collecting from the beginning, and they can do with it what they will for travelers that are coming from outside of the Atlantic region.
Thank you, Vicki. Tom Bateman, Brunswick News.
Thank you. Premier, it's clear that Nova Scotia is not as comfortable as you are with New Brunswick's reopening plan. And so are you willing to compromise on any health measures, perhaps the length of time of an isolation or a testing regime for incoming Canadians to try and meet Premier Rankin in the middle? And if I may, why haven't you spoken directly to Premier Rankin in these last 24 hours as we've seen the border dispute kind of boil over?
Well, there has been quite an active discussion with the departments and staff looking at options. So, and we'll have that call tonight. So we'll all be together there. However, I think what I need to point out is that we put our rules and regulations. I mean, we have been the ones on the border measures from the beginning. And so we have a path set forward that I'm very confident in. And I have good reason to be, because we have demonstrated through the public health measures, through the people at our borders, through the contact tracing, through so many situations where we've had outbreaks and then dealt with them. We've demonstrated the capability of the people within our province in every aspect, in every sector, and the vaccination levels, which certainly that makes the difference. So I would suggest that if additional measures are required through an individual situation or a provincial requirement, then they're free to do that at the borders of their own province. I mean, PEI have been doing that since the beginning, and Newfoundland's doing their particular, what they want to do in their border. So if Premier Rankin wants to add additional measures for people coming in, we've already met them at the border if they're traveling by land. If they're traveling by air, we will meet them at a New Brunswick airport. Nova Scotia will meet them at the Halifax airport. And if they want additional measures, they're free to do that. So I'm not sure what the implication is in the case of our situation. We're doing what we think is appropriate, and we're fully supportive of them doing what they feel is appropriate at their border.
Thanks, Tom. Jean-François Prosper à l'Acadie Nouvelle.
Oui, ça serait peut-être une question pour la Dr. Russell. Concernant la vaccination, on voit que lorsque les rendez-vous ont été mis disponibles pour le grand public, la réponse a été excellente. On parle de plus de 30 000 personnes, je pense, en une journée. Où est-ce qu'on en est à ce niveau-là aujourd'hui? Est-ce qu'on a des nouveaux chiffres? Et je voulais savoir aussi, est-ce que, avec la réponse qu'on a présentement, est-ce qu'on croit être en bonne voie d'atteindre l'objectif du mois d'août, et peut-être même le devancer si ça continue d'aller aussi bien?
Alors, notre capacité est là avec les nombres de doses qu'on reçoit. Le fait que les gens s'inscrivent pour les rendez-vous en grand nombre, comme vous dites, plus que 30 000 personnes dans une journée cette semaine. Alors, fur et à mesure que les gens ont leur rendez-vous, on va continuer à être capable d'avoir des taux de vaccination très hauts. Je crois qu'à ce moment-ci, comme je l'avais dit, on a 76,5% de la population plus âgés de 12 ans et plus ont reçu une dose. Et pour les gens qui ont 65 et plus, 38,6% de la population sont vaccinés. Alors, au niveau de la protection pour les gens les plus âgés, c'est vraiment impressionnant à ce moment-ci. Et aussi, 21,5% de tous les Néo-Brunswickois ont eu leur deuxième dose à ce moment-ci. Alors, ça, c'est aussi quelque chose qu'on est vraiment content d'avoir. Dans les derniers 7 jours, il y a 67 690 doses qui ont été administrées. Et ça, c'est le plus grand nombre à date dans une semaine. Et dans les derniers 7 jours, il y a 88 423 personnes qui ont inscrit pour leur rendez-vous pour une clinique de Horizon ou Vitalité. Et ça inclut pas les gens qui prennent leur rendez-vous avec un pharmacie. Alors, ça, c'est des très bonnes nouvelles. Quand est-ce qu'on va se rendre à 75% avec 2 doses? Je ne sais pas exactement, mais avec les taux de vaccination et les gens qui sont inscrits à ce moment-ci, si ça continue, les efforts comme ça avec la population, on va être capable de se rendre là dans les prochaines semaines.
Merci, Jean-François. John Chillibeck, Brunswick News.
Thanks for taking my question. Jennifer, you talked about the persistence of outbreaks across Canada, and I'm wondering, is New Brunswick too slow to declare outbreaks? The reason I ask, it's in relation to the Vita Living apartment in Oromocto, where there have been 12 cases. An outbreak was declared there, I believe it was June 9th. Today, I talked to the CEO of several seniors' homes in PEI in New Brunswick, Jason Lee, He also oversees a special care home in Oromocto. And he said New Brunswick Public Health seemed to be slower at declaring outbreaks than its counterpart in PEI. And he used the Vita Living apartment as an example. They had heard of cases there as early as June 5th, but an outbreak wasn't declared until June 9th, several days later. This was alarming to them because they have a staff member at the seniors home who lives there. So we were just wondering about that, if you could speak to it.
Hi, John. So a couple of things. Number one, when I'm referring to outbreaks in other parts of Canada, I'm talking about outbreaks in, specifically, there's a few outbreaks in some First Nations communities that are, in the hundreds, and again, among mostly unvaccinated people. So they're community outbreaks that I was referring to. With respect to any outbreak that's declared in any facility in New Brunswick, number one, I believe that the medical officer of health usually will do that within a day of finding out that there is a case. Regardless of whether there's transmission or exposure, they really, usually it only takes one case for that to happen. But I think separate from whether an outbreak is declared or not, the management of all the outbreaks at all long-term care facilities and nursing homes and adult residential facilities, I think deserve a lot of credit to the partners that have worked tirelessly to make sure that each and every one of those outbreaks was contained. So the prompt team, social development, the RHAs, public health, there's been, and Red Cross, have always, again, coordinated, cooperated, collaborated with the owners of the facilities. And I think that we've just had an exemplary response throughout the pandemic. And each and every time there have been outbreaks, all the learnings, whether it's a variant or not, were used for the following outbreak. So that's really all I can say about how the declarations happen, but certainly, again, usually it's one case, and it's usually the medical officer who would declare the outbreak when that happens.
Thanks, John. Thank you, Dr. Russell. Adam Hiras, Brunswick News.
Thanks, Amanda. A question for the Premier. While second dose numbers are climbing, the province has administered less than 500 first shots in each of the last 2 days. To get to 80% first doses, it's still something like 24,000 shots away. Are you concerned at the slower pace, and have you made any decisions on how you'll entice the remainder of New Brunswickers to get a first shot?
I'm going to start with that one, and then I'll turn it over to the Premier. Great question. We are very concerned about first dose uptake. Absolutely. We are encouraging people to get their first dose in walk-in situations. If you can't book an appointment, et cetera, there are opportunities for first dose walk-in clinics, walk-in appointments in many situations. We have done a focus group and doing some survey to collect information around if there are things that we can do to improve uptake for first doses. So we are working with communications, ECO, to make sure that those people are targeted based on whatever information that we have found out. So there's more work to be done there. So it is on our radar, and we are working on it collectively right now.
I don't know, Adam, if there's anything more that I can add to that. Obviously, we do want to continue the vaccination rates to climb. Obviously, we'd set the target of 75% that we felt very good about reaching, and we're very optimistic that we can match that with a second dose. Everyone needs to understand that the best prevention against an outbreak in any pocket of our province is to continue to get vaccinated, and to do so if they haven't, to just move forward, and don't ever take the position that, well, okay, that's good enough, because good enough is when you've had 2 doses.
Thanks, Premier. Thank you, Adam. Laura Brown, CTV.
Hi, Premier. Depending on the outcome of the looming Nova Scotia election, you may have to work with Premier Rankin for the remainder of your term. We're seeing just how important it is for collaboration and communication. So I'm wondering, do you think it's possible to get past this with Premier Rankin And do you foresee this forcing more Council of Atlantic Premiers meetings because of this, the need for them?
Oh, absolutely. We'll get past this. I mean, there's always hurdles. We always have, different views on topics, and it's unfortunate this one is kind of come to a head at a stage at the pandemic where we are right now, after having a very, very successful collaboration and cooperation for the last 16 months. But as far as working with Premier Rankin or whatever Premier comes along, I mean, we must, because it's the right thing to do for our region. And I don't spend time worrying about past issues or past conflicts or spilt milk, because it's what you do going forward. So we'll get past this, and we'll have a path forward, and then we'll deal with bigger issues as they arise. But I'm not concerned about the future path in working together.
Thanks, Laura. Madeleine Bizot, All New Brunswick. Madeleine? Erica Butler, CHMA.
Hi there, thanks very much. Premier Higgs, we did get confirmation that in Zone 1, there's been a strategy change for the second dose rollout, which will focus on 2 mass vaccination clinics in Moncton and Bouctouche. Can you talk about what else is happening to ensure that people in more rural areas will be able to access second doses in a timely manner?
Do you want to?
I can take that. So our work with both the RHAs, Vitalité and Horizon, has been extraordinary. And as you know, early on in one of the outbreaks in Zone 4, we actually increased the number of doses that were available in that area in a timely way during the period of time when cases were increasing there. We have been working with many, many pharmacies around the province. So I think at this moment in time, our approach has been to ensure that there are vaccine doses available all across the province. And as of, again, right now, that has been our plan up to date, and it will continue to be our plan.
Thank you, Erica. Bobby Jean McKinnon, CBC.
Yes, hello, can you hear me?
Yeah.
Thank you. Premier Higgs, Premier Rankin tweeted a little while ago asking people to give it one more week, but yesterday he said that on June 30th, the rest of Canada could come in with the same requirements as New Brunswickers, which suggested no change for New Brunswickers by the 30th. So has there been some movement here, or what do you make of that?
Well, I guess I believe there's an opportunity for us to have our Atlantic region residents moving freely before then. And I don't believe that we need to restrict that while we're looking at, and they're considering about other folks coming from other regions of the province or the country. As I suggested earlier, I think that there's a path here in relation to what we've been doing from the beginning at our borders, what we can provide for information, because we have it. We stop all the cars. We actually explain to them about the rules and regulations of each of the Atlantic provinces, depending where they're traveling. And I think there's an opportunity for Premier Rankin and others to enhance what they would like to do in their own province, should they decide to do that. And, if we identify, if they're coming by road and we identify them, let's say at the Quebec border, then they say we're going to Nova Scotia, so they head on. We can advise, Nova Scotia that they're coming, and they can stop them at their border. And if they want to test them or wherever they need to set that up, they can do that. So I mean, when we've been collecting and have the information, and obviously have shared it or prepared to share it at any time about residents going to the other provinces, because it's not new for us. We've been doing it from the beginning. Then they can meet what they want to do in their own province, and then we can let the rest of our residents move around freely and do so. And I'm saying we can do so tomorrow. There isn't really a reason why we can't, because this isn't starting something new for us. It's something we've been doing from the beginning. and they want to test or do something else in their own province, they can do that, and they can start that immediately.
Thanks, Bobby Jean. Savannah Odd, Telegraph Journal.
Hi there. My question's for Dr. Russell. You're asking, I guess, the remaining New Brunswickers who haven't been vaccinated to go ahead and take that step. But I guess go get vaccinated has been a message public health has been pushing for a long time. So how exactly do you plan on reaching these remaining people? Is there any new approach to that?
Great question. And again, we are very concerned about the people that are not vaccinated, because we know with the Delta variant that the people who end up having severe symptoms and require hospitalization are mostly those who have not been vaccinated. So whatever we can do to improve vaccination rates and uptake for first doses, we do want to focus on. But before we could do that, we had to understand why certain people were not getting vaccinated. Was it transportation? Was it time? There are some, the information that we did receive points to people not understanding the risks, feeling that they might not be at risk from getting infected with COVID-19 or the Delta variant at this time. They aren't quite convinced that there was enough research done for vaccines, and so they need a bit more education and being having the ability to have that provided to them. And also there are people who are afraid of the vaccine itself and the side effects, and so they, again, need more information on that. And then there's a portion of the population that we know have not come forward, who are women of childbearing age and who have concerns about being pregnant or getting pregnant and having the vaccination interfere with any component of that or putting their unborn child at risk. So we have to be cognizant of why people are not getting vaccinated and be able to target our messaging around that and helping people get the information that they need to be more comfortable coming forward to get a vaccine.
Thanks, Savannah. Greg Mercer, Globe and Mail.
Hi, thank you. I have a question about the lack of communication between the two provinces in the last week or so. And I'm wondering, Premier Higgs, what's the best way for the public to understand how we can have two premiers not speaking to each other on an issue this important?
I wouldn't suggest for a moment we're not speaking to each other. The protocol that we rolled out on May 27th was just that meeting of all four of us, and then the follow-up we had later was when we were getting close to that. So it was the end of the week of it was like June, probably 19th was the last, I think, conversation in relation to what we were doing that week to open up, and then since then it's been related to primarily our individuals within different departments discussing with the provinces how we best could open up to the entire bubble. So, you know, the individual positions taken, we're following the protocol we laid out on May 27th. And the cap calls that we have are routine. I mean, in nature, it just happens that the one today is focused solely on will be focused solely on this situation and coming to a resolution, because I think it's there to be had. So, you know, we have a position and a commitment that we made to the citizens of New Brunswick, and we based that on the information that's been available to us and the quality of work that we've seen from the beginning from all folks involved. And that is, you know, what we will stick to. And I think that if you know, different provinces have different views on what they think is good for them, and that's great. We've done that through the entire process. So I think the room is there for them to do what they want to do in relation to people coming from the rest of Canada, and we can get on with the bubble, which will put all this behind us. So I'm confident that meeting tonight will happen, and it is going to happen, but that we'll actually have an outcome that kind of gets us back on track.
Thank you, Premier. That concludes today's update. Voilà la fin de notre mise à jour. Thank you. Merci.